Video number 7. Determining the impact of alcohol abuse and methods to repair the damage done. In order to understand the impact of alcohol abuse, we first need to know the effects of alcohol, which can be influenced by a number of risk factors, such as the amount consumed, individual's medical history, tolerance to alcohol, as well as other drugs, legal or illegal, mixed with alcohol. Let's have a detailed look. Number 1. Understanding blood alcohol content, BAC. Depending on your BAC, you can experience an array of side effects that range from minor complications to more severe ones. Here's a breakdown of different BAC percentages along with their symptoms. Number 1. BAC 0.033 to 0.12%. Improvement in method, higher self-confidence, less anxiety, flushing of the face, shorter attention span, lack of fine motor coordination, impairment of judgment. Number 2, BAC 0.09 to 0.25%. Sedation, loss of memory and lack of comprehension, delayed motor reaction, balance problems and ataxia, blurred vision and sensation impairment. Number 3, BAC 0.25 to 0.40%. In and out of consciousness or complete unconsciousness, amnesia during the event while intoxicated, staggering gait, vomiting with aspiration, respiratory depression, incontinence of urine, slowed heart rate. Number 4, BAC 0.35 to 0.80%, comatose, lack of pupillary response to light, life-threatening respiratory depression, severe decrease in heart rate, death. Number 2, short-term health effects of alcohol, dizziness, lack of judgment, loss of coordination, memory loss, vomiting, headaches, and hangovers, accidental injury to yourself or others, being in a road accident, deliberately harming yourself or others, alcohol poisoning, which can be fatal. Number 3, long-term health effects of alcohol, brain. Drinking too much can affect your concentration, judgment, mood, and memory. Heart. Heavy drinking increases your blood pressure and can lead to heart damage and heart attacks. Liver. Drinking 3 to 4 standard drinks a day increases your risk of developing liver cancer. Long-term heavy drinking also puts you at increased risk of liver cirrhosis, scarring, and death. Stomach. Drinking even 1 to 2 standard drinks a day increases your risk of stomach and bowel cancer, as well as stomach ulcers. Fertility. Regular heavy drinking reduces men's testosterone levels, sperm count, and fertility. For women, drinking too much can affect their period. Number 4, psychological effects of alcohol. The damaging effects of excessive alcohol consumption may vary depending on a variety of factors, including the quantity and frequency of consumption, the age in which a person begins drinking, and how long they continue, the age, education level, gender, genetic background, and family history of alcoholism, the overall health of the individual. Number 5, how does alcohol damage liver? The damaging effects of excessive alcohol consumption may vary depending on a variety of factors, including the quantity and frequency of consumption, the age at which a person begins drinking and how long they continue, the age, education level, gender, genetic background, and family history of alcoholism, the overall health of the individual. Number 6, hepatic encephalopathy. The psychological effects of alcohol from hepatic encephalopathy include sleep pattern changes, changes in mood and personality, depression, anxiety, and other psychiatric conditions, cognitive effects such as shortened attention span and problems with coordination. Number 7, how to repair the damage done by alcohol abuse. Stop drinking. Many people believe that cutting back significantly in their drinking is good enough. However, those who have alcohol hepatitis or cirrhosis will still experience further damage with any alcohol consumption, a bit at a slower rate. Total abstinence is the only full solution. Stop smoking. Cigarettes contain toxic additives. When you inhale these additives, you send them for processing in the liver. If obese, lose weight. Being overweight and abusing alcohol isn't twice as bad, it's 4 times as harmful. Eating well, veggies, fiber, and antioxidants. A healthy diet promotes good health. Avoid exposing yourself to toxins. Whether you breathe them or they come in through your skin, toxins eventually pass through the liver. Exercise. Getting regular exercise helps reduce your risk of liver cancer, boosting immune function and fight against obesity. Avoid hepatitis B and C. You really don't need hepatitis B or C, especially with a history of heavy drinking. To protect yourself from these diseases, get vaccinated. Use condoms. Avoid beauty treatments such as manicures or pedicures unless you know all instruments are sterile. Likewise, avoid tattoos and piercings unless you feel confident of sanitation practices. Watch your medication. Overdosing on certain over-the-counter medications can do your liver a lot of harm. Talk to your doctor about all the medications you take to avoid interaction effect. A wide range of health benefits are associated with quitting drinking, but the repair to one's liver is among the most noticeable of them all. This means that for most people in recovery, it's possible to make up for the past trauma and abuse your liver has taken, and even better, keeping it healthy going forward. Thank you for watching. See you in the next video lesson.